and they just joined. I think some technical problem. They will be joining us shortly. Georgia from Brazil and Dr. Mabuya from South Africa would also be joining us. And representing India on the panel to speak is Mr. Ashish Jain, the CEO Healthcare Sector Skills Council from India. Can we see? Yeah, Ashish is also there. And welcome to all of you. In addition to this, almost 300 participants have registered from all the member countries of Brazil, Russia, India, China, and South Africa. And as we see it, the participants who are logging in is going up the number, almost 300 of them registered. Many of them are practicing doctors, healthcare providers, and academics and policymakers, and also non-governmental organizations. A big welcome to all of you, the participants here. And before I request our panelists and before that, our keynote speaker to provide their inputs, a bit of background on what we do in BRICS I would like to take. First of all, the BRICS, Brazil, Russia, India, China, and South Africa. And the BRICS has been a very, very important international platform, global platform for the member countries to enhance their cooperation on the areas of mutual interest. India is the chair of the BRICS Forum this year, and FICCI, Federation of Indian Chamber of Commerce and Industries, it's a federation of the chambers in India and the largest federation of the industry in India. It is coordinating the business council, the private sector engagement, and on behalf of India under the BRICS format. So the BRICS Forum has about 9 working groups. One of those working groups is on skill development. I chair this working group as a skill development on behalf of FICCI. And the whole idea of these working committees are to identify themes of common interest and go deeper into those and figure out initiatives and actions that will be of common interest to all the member countries. So FICCI has been the forefront of leading the Business Council for several years. In fact, on 31st of August, we have the BRICS Business Council meeting. This year, we have been working all these months on the skill development forum related initiatives, and inputs from all the working groups, including skill development, will go to the BRICS annual conference, which will be held on 31st of August. On the skills working group, we have further identified 4 themes, cross-cutting themes that are of common interest to everyone. Those 4 themes are, one is that how do we enable greater cooperation and understanding amongst the policymakers of member countries? Member countries, when I mean member countries, Brazil, Russia, India, China, and South Africa. The policy level engagement. Second is the sharing the best practices related to the skill development programs, both in government and private sector, for which we have created a knowledge portal, and the knowledge portal would serve as a sort of window for exchange of these best practices. The third area is that future skills. How do the member countries address the challenges related to the future skills? And the fourth is the global mobility and seamless movement of skilled workforce from country to country globally, in general, amongst the member countries in particular. And 2 sectors as well we identified apart from these cross-cutting themes. These sectors include, one is the healthcare, another is the digital economy. And healthcare related skills is the topic of today's webinar, and the importance is known to all of us. The COVID has disrupted everything that we have been doing, particularly the healthcare sector. Both the infrastructure and the human resources were stretched to the last. And we have seen the stories of pain and agony amongst everybody. But the governments have responded, private sector has responded, civil society has responded to the best that they could do. And as a result of that, we have several best practices that have evolved in the respective countries. And therefore, we thought it is appropriate that the member countries share the best practices that they adopted for the healthcare in the context of COVID. and how these countries have addressed this issue related to the quality and quantity of human resources. How did they augment the skills capacity? How did they ensure that better care is provided to the COVID, both for prevention as well as the management of COVID? So that's the broader topic and the focus of today's webinar. And as I said, we have our colleague from Brazil joined. Are you there, Adriana? Can you hear us?
Yes, I can hear you well. Thank you.
Thank you very much. And she represents the Brazil on the Skill Development Forum. Welcome to you, Adriana.
Thank you.
Before I request the panelists to share the perspectives of the respective countries, may I request Mr. Vedmani Tiwari, the Chief Operating Officer and officiating CEO of NSDC, to provide a keynote address on skilling of healthcare workforce, particularly in the context of COVID, as to how we responded to that. And just as a timekeeper, we have till 5:30 the session. And after Mr. Tiwari speaks for about 15 minutes, then each panelist will get about 10 to 15 minutes to share the best practices. Thereafter, if there is time, we will take some questions to respond. And at the end, Sumit from FICCI will sum up and provide the action plan going forward. With this opening comments and providing the framework, now I'd request Mr. Vedmani Tiwari, the Chief Operating Officer and officiating CEO of National Skill Development Corporation, to deliver his keynote address. Thank you.
Sir, kindly unmute yourself. Yeah, thank you.
Thank you so much, Mr. Reddy, and I congratulate FICCI for organizing this important webinar. Good afternoon to everyone and a warm welcome to everyone who are present here today. I would like to thank BRICS Business Council for giving NSDC this opportunity to exhibit and discuss the work undertaken by India to fast-track skilling of healthcare workers. It is indeed an important topic of discussion and a critical part of strengthening India's COVID-19 response mechanism for better management of the virus. We all have closely watched that how the pandemic disrupted many lives, industries, together with putting immense burden on the healthcare workers and the infrastructure. The two waves of the pandemic have urgently called for deploying means to invest in capacity building of India's health workforce, meeting its own needs and in due course supporting other nations. The pandemic was also an eye-opener in many ways as it uncovered the existing challenges in the healthcare sector and the gaps that existed in terms of affordability and accessibility for the patients. Therefore, there is a compelling need for building capacities, establishing the right infrastructure, and improving the quality of healthcare workers who are constantly delivering care and services to the patients. And with this, our Honorable Prime Minister Shri Narendra Modi launched a customized crash course program for COVID-19 frontline workers on June 18 this year, with an aim of training over 1 lakh frontline workers across 111 training centers in 26 states of India. During the launch, he stated that this is an important initiative of the next phase of the battle against COVID-19. With an overwhelming vision of Skill India, NSDC is aiming to provide adequate training to India's youth in the market-relevant skills and improve the scope of underdeveloped sectors. The mission aims at giving a better livelihood to India's youth and respect in the society with training and certification. The customized crash program for COVID-19 frontline workers aims to skill adequate number of non-medical healthcare workers to fill the gaps in the country's healthcare infrastructure and meet the demands of the future. Once the candidates have finished the course, they are deployed under public and private healthcare entities across India for 3 months for the on-the-job training. The candidates are also provided with several services of food, lodging, and stipend. By closely monitoring and assessing the progress of these candidates under this special program, our target is to create a talent pool that can reduce the existing burden on our frontline workers. Because while India needs doctors and nurses, there is a huge requirement felt for other mid-level care providers who can lighten the load that currently exists on our healthcare providers. There is no denying that our healthcare workers have showcased immense grit and limitless compassion when it came to handling the adverse impacts of the virus. However, they were also faced with a new challenge each day when it came to safeguarding the health of our citizens, which reinforced the need for bettering the overall healthcare setup. And keeping this in mind, Crash Course Program for COVID-19 frontline workers was launched for providing complete support to our healthcare fraternity. This also calls for a joint effort at the center and state level, required to create robust infrastructure, vigorous systems, creating abundant human resource capacity in the health sector. And India's government is strongly looking into this by creating right synergies between the center and the state. The launch of the Crash Course Program is a great example of this. Building a strong infrastructure for ensuring that there is no shortage of oxygen supplies has also been the priority of the government of India. Training of heavy vehicle drivers for driving liquid medical oxygen tankers is being undertaken by NSDC and Logistics Sector Skill Council. Additionally, training of around 15,000 ITI graduates for formation of quick maintenance team in districts for operation and maintenance of oxygen plants, mini oxygen concentrators, and medical ventilator has also been mapped out. The Union government has also joined forces with a cluster of countries for imparting skill training in the health sector that are expected to generate jobs worldwide, following the changes imposed by the COVID-19 pandemic. Ministry of Skill Development and Entrepreneurship has identified 300,000 jobs in the healthcare sector alone in countries such as Australia, Germany, Canada, Japan, Sweden, and Singapore, increasing the scope of opportunities in the healthcare sector. The World Economic Forum also announced in January 2020 that the world is facing a reskilling emergency and we need to reskill more than 1 billion people by 2030. Therefore, it is essential that we continue our endeavors focused around upgrading of the skills of our workforce. Like our Honorable Prime Minister Shri Narendra Modi also stated last year on World Youth Skill Day, it is only by skilling, reskilling, and upskilling that our youth can stay relevant in the current business environment. Hence, we are working in close collaboration with Healthcare Sector Skill Council to find solutions for our existing healthcare burden. There are various initiatives that the organization has been taking to address the skill gap in the sector to resolve the challenges faced by healthcare providers as the nation focus has moved extremely towards wellness and prevention. WHO has also said that India needs to dramatically improve its health situation to sustain growth as it shares 21% of the global disease burden. Therefore, all our endeavors are directed in a direction where we can change this scenario and create India as a healthy hub. Additionally, bridging the gender-based skill gap to improve the ratio of women employment is a key area of interest for the government of India. And with this, several rules and programs have been initiated under Prime Minister's Kaushal Vikas Yojana to increase women participation. In fact, our Honorable Prime Minister has lauded the efforts of ASHA workers, ANM, Anganwadi, and health workers deployed in the dispensaries in the villages who are one of the strong pillars of our health sector. He said that their role is huge in preventing the spread of infection in villages, in remote areas, and in hilly and tribal areas. Officials have also been directed to empower ASHA and Anganwadi workers with all necessary tools to boost the fight in villages. With such an important role being played by women care providers, it is our belief that more women will come forward to become a part of this campaign and will be further empowered to facilitate. I would like to express immense gratitude towards our healthcare workers and frontline staff who showcase extraordinary courage towards mitigating the risks posed by the pandemic and strengthened our COVID-19 efforts. They are truly our corona warriors. They helped save many lives and tirelessly battled this infectious disease. And also makes me proud in stating the efforts of Government of India in launching the largest vaccination drive in the world, ensuring complete safety of our citizens. The success showcased in the last 6 years and the number of initiatives launched under the Skill India mission speaks volume about the efforts laid in this direction and the seamless convergence test across skill development programs in the entire nation. There is no doubt that the pandemic has increased our industry challenges, but we will stay united in focus towards overcoming these constraints. Thank you so much.
Thank you so much, Mr. Tiwari. And as he explained, NSDC has been playing, National Skill Development Corporation has been playing an important role in building the quality and quantity of healthcare skill providers in the country. As you know, in India, just to supplement to what Mr. Tiwari said, is apart from the frontline healthcare workers, he mentioned about how the drivers of the heavy vehicles which carry the oxygen tanks are also being trained. He talked about how technicians, pool of technicians who can install, repair of oxygen tanks and other equipment for COVID management have been trained. Upskilling of paramedics and nurses has been a big focus, and upskilling of doctors as well. All these, in addition to NSDC, which has been at the forefront, the Government of India, Ministry of Health and Family Welfare, the state governments, multilateral organizations like UN Women, United Nations Women, on upskilling the nurses. Then several civil society organizations, philanthropic organizations have been doing phenomenal work in India, because we required to bridge the gap in knowledge, the quantity and quality of skills in a very shortest possible time. So everybody had to come together. And as a result of that, you can see today, India is better prepared to handle any possible next wave of COVID infection. Thank you very much, Mr. Tiwari, in this, leading the fight in this. Now, I request our panelists, we will go in the order of the BRICS, to begin with from Brazil. And we have Georgia. Georgia leads, she is Industrial Development Specialist and Social Service of Industry from Brazil. And the interpreter, Adriana, is also here. Over to you. And would you like to share your experience of how during COVID pandemic, you address the challenges related to skilling, and maybe 10 to 15 minutes you could take to explain your experiences. Over to you, Brazil.
Good morning. I'm just having some trouble opening my video camera. Just a minute. I'm not being able to open the video camera. Adriana, não sei se abrir. Okay. Okay, now I'm seeing. Can I share here? Just a minute.
Yeah, please go ahead. Please go ahead, Georgia.
Ok. Bom dia a todos aqui no Brasil ainda de manhã.
Good afternoon. Good morning to everyone. We're still morning in Brazil.
Good morning.
Agradeço a oportunidade em nome da Confederação Nacional da Indústria, né, por apresentar aqui a experiência das indústrias brasileiras no combate à Covid.
On behalf of the Brazilian Confederation of Industry, I'd like to thank you for the opportunity to present what was done by the industries in Brazil to combat COVID.
Ok, eu vou compartilhar agora minha tela para trazer uma breve apresentação.
I'm going to share my screen with you so that I can make a brief presentation.
Vocês enxergam minha tela?
Can you see my screen properly?
Yes, we can see. We can see the screen.
In Brazil, no Brasil, as empresas tiveram que enfrentar 3 grandes desafios, que
businesses or companies in Brazil had to face 3 large challenges.
Que é prevenir a Covid no ambiente de trabalho, sendo a Covid uma doença não ocupacional.
By having to prevent COVID in the workplace, being that COVID is not a labor-directed disease.
Também prevenir ou evitar que as pessoas com doenças crônicas, trabalhadores com doenças crônicas, piorassem a sua condição e pessoas piorassem os seus hábitos de vida ao longo desse período.
Especially by helping prevent people that had other previous health conditions could be protected, and other people would not worsen their lifestyle or any other chronic health conditions during the pandemic.
E outro ponto muito importante que surgiu foi a questão da saúde mental, como promover saúde mental nesse contexto da pandemia.
Another axis was how to promote mental health and to prevent mental health issues during this context of the pandemic.
Bom, em relação à prevenção da Covid no ambiente de trabalho, as empresas experimentaram um modelo de atenção que para nós foi muito bem sucedido e foi uma experiência nova, porque nós desenvolvemos uma jornada do cuidado que ia desde o monitoramento populacional de todos os trabalhadores.
So to prevent and manage COVID in the companies actually worked on a new model that we were very proud to see working. And this model encompassed a lot of phases, from the very beginning of screening and preventing, from the beginning of the onset.
E a partir desse monitoramento, agir de forma muito ativa para identificar casos suspeitos, confirmar casos e acompanhar esses casos todos, tanto suspeitos quanto os confirmados, ao longo do tempo. No caso dos confirmados, o acompanhamento foi até meses após a doença ter sido curada.
So this monitoring was actually quite complex and very active. It included everything from identifying any suspected or confirmed cases, following or monitoring the people that were confirmed during months after confirmation.
E tudo isso foi possível com o apoio de tecnologias como telemedicina, telesaúde em geral e equipamentos de saúde conectada, como aplicativos, né, que os trabalhadores usavam ao longo de todo o ambiente, toda a jornada de trabalho.
All of this was made possible to great part due to technology. Technologies such as telemedicine or telehealth services, and also through equipment as apps that were connected and could monitor these people or could track these people during all of their journey.
Dos exemplos, por exemplo, foi esse aplicativo de rastreio chamado de mapeamento preventivo de interação, utilizado por uma das empresas brasileiras, a Ambev.
One of the examples was this app that was used by a Brazilian company, or Ambev, and this is a tracking device to prevent, it's an interactive mapping device.
E essa empresa pode utilizar essas informações de muitas maneiras, não apenas para rastrear os contatos dos casos confirmados ou dos casos suspeitos, mas também para antecipadamente observar localidades onde havia um maior número de contatos críticos, e aí já agir proativamente para educar melhor aquela população ou para ver que mudanças ambientais poderiam ser feitas para reduzir esse contato crítico.
So this app was used in a very interesting way, not only for contact tracing, but also to prevent the possible locations or the locations that could be potentially of greater contamination, so that attention could be provided before the problem outbursted.
Bom, uma outra frente de ação foi em relação ao estilo de vida e a gestão de pessoas com doenças crônicas não transmissíveis.
Another aspect. I'm sorry, another front of action was also regarding the lifestyle, the lifestyle of the employees.
Certo. E, bom, de novo, para fazer a gestão dessas pessoas, da saúde dessas pessoas, muitas delas, com doenças crônicas, foram afastadas do trabalho durante todo esse tempo e ainda não voltaram até hoje, e elas foram acompanhadas de forma ativa por meio de serviços de telesaúde.
Already, another aspect that was employed in the management of health of the people that had other chronic health conditions was that they were removed from the workplace. They have still not returned to the workplace, and there was health monitoring, active health monitoring of their conditions.
E para evitar que as pessoas tivessem uma piora no seu estilo de vida, também as intervenções já existentes nas empresas foram adaptadas para o modelo à distância para aqueles trabalhadores que estavam fora do ambiente de trabalho.
And also to prevent any worsening of the health conditions, of the lifestyle of the people that were removed from the workplace. There was also monitoring to help prevent worsening of their conditions remotely, so that this assistance could be provided not only to the persons that were in the workplace, but as well as those who were removed from the workplace due to their chronic conditions.
Em relação à saúde mental, no Brasil, a saúde mental já era a segunda causa de afastamentos e incapacidade de trabalhadores. Mas existia um tabu em cima do tema, tanto por parte dos trabalhadores quanto por parte das empresas. Então, era um desafio que não era adequadamente enfrentado antes da pandemia.
Regarding mental health, it already was the second highest reason or cause for removal from the workplace or from distancing from the workplace. And there existed a very strong taboo against mental health issues, not only by workers themselves, but also by the companies. So this was a very important challenge in addressing this entire problem.
Então, a pandemia, ela piorou essa situação, mas ela também permitiu que tanto trabalhadores quanto empresas enfrentassem esse problema, que já é um problema antigo.
So the pandemic actually did worsen this condition, but at the same time, it allowed for this condition to be faced not only by the workers, but also by the companies. So it began to be more broadly addressed.
E além das atividades à distância, por telesaúde, para atender o indivíduo que estava em crise ou que, enfim, tinha alguma questão pessoal, foi desenvolvido um conjunto de serviços para ajudar a empresa a se preparar para isso. Então, por exemplo, avaliação de toda a população, preparação das lideranças para lidar com isso, preparação de uma brigada de emergência psicossocial, né? Então, pessoas que estavam preparadas para lidar com emergências psicológicas no ambiente de trabalho.
So, in addition to this distance monitoring to prevent and deal with personal crisis, the companies organized a set of services that assisted in the evaluation and assistance to people. And this was done also in person through the training of leaderships, through the training of brigades that had proper training on how to handle these different situations.
E os principais temas que foram tratados foram a questão do luto, da insegurança em relação ao trabalho, do isolamento social, das sequelas que estamos observando em relação à Covid e também uma forte prevenção ao suicídio, porque o suicídio muitas vezes surgiu em decorrência, por exemplo, de um trabalhador se sentir culpado por achar que contaminou os pais, sabe? Ou por achar que ele não cumpriu e foi para uma festa e aí se contaminou.
The main topics that were addressed by these teams that were trained to deal with these mental health issues were grief, insecurity, isolation, people feeling guilty for having contaminated co-workers or parents or relatives, the prevention of suicide, because that usually came from the guilt that many people were feeling for having possibly infected or contaminated their loved ones.
Então, o que nós aprendemos dessa pandemia, apesar de toda a crise, foi uma grande oportunidade para que a empresa desenvolvesse um modelo de assistência integrado, longitudinal, centrado na pessoa, né, que permitiu esse monitoramento, essa ação desde o monitoramento populacional até o acompanhamento de toda a jornada e retorno ao trabalho.
So what we learned from this entire process is that this really did lead to an opportunity for us to develop assistance that is more centered on the person, that encompassed everything from monitoring, populational monitoring, to tracking and monitoring persons that were facing the issue on a more direct and personal basis.
Uma outra coisa que nós aprendemos é que os recursos de telesaúde, de saúde conectada, foram ferramentas fundamentais para contribuir para esse modelo integrado e para permitir uma melhor organização desse cuidado continuado. Também permitiu... pode falar.
Something else that we learned even more was about the importance of these telemedicine, telehealth services that allowed, that they were essential tools that allowed and contributed to the better organization and better monitoring of all of the people in the process.
E também permitiu melhorar a logística, ou seja, as pessoas que estavam com sintomas, se sentindo doentes, em vez delas irem diretamente a um pronto-socorro e, dessa forma, podendo contaminar outros nesse caminho, e se contaminar ou contaminar outros nos postos de saúde, elas tiveram rápido acesso à assistência médica antes de seguir para uma unidade presencial de saúde, e essa triagem referenciada favoreceu ali uma assistência mais segura para essas pessoas. Muitas não tiveram que ir, ou quando foram já encaminhadas de uma forma mais segura para o atendimento presencial.
Something else that we learned was about how much these tools, these telemedicine and telehealth tools, helped with the logistics, because when somebody felt the first symptoms, instead of going to the ER and possibly contaminating others, they had rapid access to these services through which they could have better triage, and this triage favored more specific and more directed assistance to what they were feeling.
E, por fim, o que nós percebemos é que essas ferramentas tecnológicas, por cobrarem, por exigirem que os trabalhadores participassem mais, tanto da coleta de sintomas, né, o constante monitoramento de sintomas. Alguns deles recebiam equipamentos em casa para monitorar, por exemplo, a saturação de oxigênio e outros indicadores de saúde. Essas pessoas, elas não só se engajaram mais no tratamento, mas elas se empoderaram mais do assunto.
Something else that we saw was very beneficial from these tools, from these technological tools, was that since they required the participation, the direct participation of workers who were informing of their symptoms through these tools, some actually did receive equipment at home. So, for example, the oxygen meter, and other equipment to track other of their health indicators. Not only were they more engaged, but they also felt more empowered to deal with the situation.
Bom, então essa era a experiência que nós gostaríamos de compartilhar e estamos à disposição para dúvidas, se surgirem.
So that is the experience that we wanted to share with you, and we are available to answer any of the questions or doubts that you may have.
Thank you so much. Thank you so much, Georgia and Andrea. And you brought out so clearly about how you managed to put up technology-based systems for prevention and management of COVID for the workers. And as the industry chambers, and the initiative that you took was commendable, and particularly the trainings right from the leadership team to the worker level, and the wide range of trainings that you organized were also very, very impressive. And thank you so much for sharing this valuable experience. Now I request the experience sharing from India, Mr. Ashish Jain, the CEO Healthcare Sector Skills Council India. Ashish, would you like to share your Indian experience, please? You are on mute, Ashish.
Thank you, Chairman. And I wanted to thank each one of the participants who are there. I think it's a good learning session for all of us as well. And I think all of us, as Chairman indicated in his opening remarks, have gone through a journey which has its own learning. And probably such session can help all of us to learn from each other and see what we can actually adopt from others and do better in our countries. So wonderful experience sharing by Brazil. I'm sure there's similarities what we have done in India as well, what Georgia explained, so I'll not go into that, but it seems like we are on a similar path. Each country is actually looking the way to deal with the COVID and coming out in terms of the similar practices. As I think the keynote speaker covered about what we did differently, what are the best practices we did adopt in India, I'd like to cover on 4 or 5 areas which may be useful for sharing here, and I'll be happy to answer any details if that is required. I'll speak from the experience of our country, India. I think in our country, Government of India has, especially the Ministry of Health, has led forefront in terms of responding to the COVID, and today we are actually referring only to the skilling component. So I'll restrain myself to talk about only the skilling component of it. It is a converged effort which was taken across the country in terms of skilling the people required for the healthcare sector. We have different states, like federal states in the country, like so many of the countries, but it was one effort which was done across country, along with the states pitching in, the federal structure which we have, state governments pitching in. So we had one effort which was going in to respond to the COVID across country. Like as the previous speaker mentioned about an app. Similarly, I think we also India have an app to trace and to talk about, and which was used extensively across the country to trace the COVID patients, and also to trace where the concentrations are, etc. So those are being worked around in our country as well. I quickly come to what we have done. So like in terms of the skilling, we have seen that India is a large country. And if you look about in terms of the population, probably out of the BRICS, we would be, after China, will be the largest one in terms of number of population. In terms of the population, our challenge was a little bigger, in terms of the size of the population we have to deal with. And we have, as is very well known, that we have shortages of doctors and nurses in country. If you go by the aspect of a WHO's, the standards which are provided, and we need to augment this healthcare workforce in the country very quickly. As the keynote speaker, Shri Ved Mani Tiwari also spoke about, that Honorable Prime Minister of India, Shri Narendra Modi, actually launched specific COVID skilling programs in the country, which are only meant, which is a response to the COVID, which are meant to train people only for COVID specific skilling. These are not courses which are meant beyond COVID response. These are meant to train, say, for example, I heard our previous speaker talking about, the in terms of the oxygen requirement, equipment requirement. So we had created courses, similar issues we have faced in India also. We had people, but how many doctors and nurses do we have who can actually deal with the number of cases at one point of time in our country? Probably we are almost getting 400,000 cases in a day. So how do we deal with such number of cases with limited capacity of our doctors and nurses? So the government of India responded by saying, let's train people specifically on COVID, which can support our doctors and nurses and our healthcare professionals for doing their duties. They cannot be trained on the clinical side, but they can be trained to support these clinicians in their respective duties, which they can be unburdened of. Say, for example, while a patient is in ICU or in a critical care unit, there's and the oxygen saturation levels are going down. You need a simple thing for him, of course, other than the ventilator. Can you put him in a proning position? Do I need a doctor now to put him in a proning position, or do I need a nurse to put him in a proning position, or could there be somebody else who can help and assist a nurse or a doctor to do this? So what we focused on as a healthcare sector skill council of India is we identified the areas which can then be taken from the nurses, doctors, allied health, and be given to other 8 people who can be trained very quickly in the shortest possible time to take this load from these healthcare professionals, and be made available to our doctors and nurses so they can devote more time on more clinical duties, talking to more critically ill patients, and do away with these mundane jobs. So 6 of such courses are created, which range from basic care to the advanced care, and about the medical equipment as well. Very important topic about sample collections. Until unless we collect sample, we test, we would not know what is the situation in the country. So we have actually training people on the sample collection. As our keynote speaker mentioned, our target is to train almost 100,000 people in the country in the quickest possible time. When I say quickest possible time, we are looking at best in 2 months of time, 100,000 people in the country who would be available to us in these 6 areas. And that's what we are going on. As we are talking to you today, almost 25 to 30,000 trainings are ongoing in the country at this point of time on these areas. Other point which I wanted to mention about you is, to mitigate the COVID, the other thing is the vaccination. I think that's the very important tool. Again, how do we do it? Again, given the size of our country, given the population, I think we need to reach out to the last, mile to say that everybody is vaccinated. We should have so many vaccination doses, etc. I think one of the biggest vaccination drive is ongoing currently in the country. And what is being done right now is, I think a lot of campaign is going in around country to see how the vaccination has been done. And I think it's the first time a app is created which actually facilitated the entire experience of vaccination from the registration till the observation time. So that is the new thing which has been created again in the country to see that it goes seamlessly. Although yes, technology have its own nuances, sometimes it does bring in some of the challenges and issues. But having said that, I think on a larger front, I think those has been taken care of. And we are happy to share that today I just read in the newspaper that half of the Indian adult population is already vaccinated today. So that's the kind of achievements which has been done because of this technology. Similarly, I think in terms of the skilling part related to vaccination, a lot of vaccination training has happened. We have a lot of doctors, nurses, and people who were actually vaccinating. They are authorized to vaccinate. But in the meantime, many other people are also trained and skilled to vaccinate, because we didn't have enough doctors for actually treating. So where do we have people for vaccinating? So idea was, can we train more categories, bring in more categories who can be trained in to provide vaccination across country? So Government of India took an approach and decided that so many other categories could be trained quickly and can provide vaccination across country. And that has actually helped us in try to reach out to this large population as quickly as possible. And that's the skilling effort which has gone in. Similarly, in terms of, as I already spoke about the medical equipment side, a small thing like, how do you actually, everybody's not trained to use oxygen cylinders and oxygen concentrators. These small things could have saved millions of many lives in the country, and we did that. We did had modules created by the government of India, multiple arms, which are available online across freely to everybody. They can actually go online on the portal, which is called Gov portal. They can learn it, refresh their skills. Even if they want to get a certificate, they can get a certificate also from there, and they can learn how to do it. So multiple modules have been created, easy to learn modules, multiple languages. Like India has, every few miles we have a new language. So in our country, we had converted this content to multiple languages so that it's easy to use, easy to understand. So that's also been done. Very important thing which previous speaker also alluded to about is the online, teleconsultations, telehealth. I think we had a new guidelines which came in for telehealth. We had a new skilling which happened around telehealth. So if you see, the usage of telehealth and teleconsultation has increased tremendously after the COVID, which also resulted in the skilling component as well. Earlier the thought was healthcare skilling cannot happen online, and this has to be on site only. So I think there's a change in perception which has come in, which has been of course forced on us now, but we are realizing in the due course that this can be done. And there's a blended mode of learning which is happening in the healthcare skilling also now, which is actually helping our country to train and skill large number of people, not only in cities, not only in the the tier 1 city or tier 2 city, even going to the hinterland, going to the places, because internet connectivity is such thing which in our country now is quite robust. So we can actually reach out to the every person. He or she can learn over his phone or through YouTube or through whichever mechanism. So there is a possibility of learning and creating the skilled workforce in India, which is required in dealing with the current times. What we also did with once is COVID, then we were all locked into, we gone into the locking stages. We unlocked once, we again gone into locking, and I want to again unlock. So if you look at the current situation, I think there are certain parts in our country which are still into lockdown stages in certain phases, and certain are opening up. So what we are trying to do from the skilling perspective and helping this to overcome, that our economy also comes back on road. We are also skilling the people in the country, not only the general public, not only the patients or not only the healthcare people, workforce. We are actually training people in the organizations. We are training people in the business houses, in the community, in every places, to see if they come back now to their organization for work, what are the things they need to do? How do they need to behave? What are the COVID protocols they need to, take care of? Simple thing as like hand washing. What are the steps for hand washing? What you need to do as a hand washing? What is the respiratory, etiquettes which you need to follow? What are the things if you find any suspect, what you should do and what you should follow? So we are trying to train people across sectors. Say, for example, the hospitality industry, textile sector, apparel sector, saying so that people can come back and economy also can be on, start working again, which is very important for us in terms of survival as well. So I think I'll stop here, Chairman. In case there are any things, I'll be happy to, detail on them. But thank you so much for giving this opportunity.
Thank you very much, Ashish. Thank you very much. The problem is complex. The problem is huge given the India's scale, size, and challenges. And so far, phenomenal work has been done. And in fact, this crash course that was launched, about 100,000 people to be trained in the shortest possible time. And so is the case of several other initiatives. And let's hope all these initiatives would work and we'll be in a position to prevent the COVID next wave to the extent possible. Thank you very much, Ashish. One request to all the panelists or the participants, if you have any questions, please type out that question in the chat box, and they also specify as to which panelist this question is addressed. Respective panelist would respond in the chat box itself. Now I request the colleagues from China to share their experiences. Dr. Quinn. Dr. Quinn is Professor, Institute of Nuclear and New Energy Technology, Department of Computer Science and Technology, Sinua University, and Beijing. And along with him, his colleague is there, Dr. Yon, who is an expert in health and social care projects, and she is part of World Skills Competition of China. So may I request Dr. Pin, followed by Dr. Yan, to share your experiences, please.
Well, thank you, Mr. Chairman. Hello, everybody. I'm glad to be here to share with you about my work about how to increase the skill of primary clinicians in disease diagnosis. Okay, I would like to show you my slide. Can you hear that? Can you watch that?
No, not yet. Yeah.
Not yet.
Yeah, now it's coming. It's coming. It's coming. Yeah.
It's coming? Okay.
Yes. Yes.
Okay.
Now we can see.
I would like to share you with a different point of view of how to increase the skills of the primary clinicians.
Dr. Pin, if you don't mind, can you put this slide? It is on slideshow mode. Can you just go and put it on slideshow? Yeah.
You want to see this one?
Done.
Bigger?
Perfect. Perfect.
Perfect. Okay.
Yes.
Okay. My point of view is that we can provide the learners about a skill to help them to do the disease diagnosis. And also the user can learn from the tool. My tool is named as DOCG, which is a dynamic uncertain causality graph. That is developed for the AI-aided general clinical diagnosis. This system can enable primary clinicians to do differential diagnosis as experts, so as to increase skills and avoid infection due to gathering in big hospitals. Well, now I would like to give you a look about the system. Just a moment. Okay, as you may see here, this is the home page of the tool. And once the patient is coming, she or he wants to do something. Okay.
Dr. Pin, we can't see the demo.
You can see it?
Only, yeah, you started the demonstration of the tool, am I right?
Yeah, I want to show you the tool.
Yeah, so.
Can you see this one? Just a moment. Can you see
Yes.
it now?
Yeah.
Yes?
Yes.
Okay. Okay, this is the home page once the patient comes to a doctor. I'm seeing the primary doctor, and he is not very experienced. And this tool can help him to do a professional diagnosis about what the disease the patient has. Okay, first, this is a young lady, and her age is 26, and he's going to say his problem about the joint pain. Okay, I'm sorry, I cannot see this. Okay. Now this is the home page about how to diagnose the joint. I'm sorry about the Chinese characters because I have not translated into other languages, but I can explain what that is. Okay, the first item is the risk factors, which will influence the probability of of the diseases, and this is symptoms. Patient may have different symptoms, and the physical signs, and the laboratory checks, and the image examinations, and the pathology checks, etc. And you can input anything that you want, and the explanations and degrees, etc. Say if you want to have a married the blood pressure, and you can have the description about how to mix the pressure. Sorry, okay, this is just some demonstration. To save the time, I would like to just input a record of a real patient. Now, that is, okay, these are the necessary items that to diagnose the disease about the joint pain. These items are necessary to be answered. Okay, we can also have this one to point out what of the joint pain, where the joint pain is. Okay, so once we input some of the necessary information, we can have a diagnosis. Now, it is online. Now we have got the diagnosis. The first one is SLE, and the degree is about 42%, and the confidence is about 43%. Okay, what is the next medical check that we should do? We can push this button, and it recommends 3 items, 3 questions that you need to answer. Okay, this one, the positive, negative, negative. Okay, once you click this, the information has been put into here, and we can diagnose again. You can see the SLE probability has been increased a little bit, and also the confidence about how we can make this diagnosis. And we can do the further recommendation. Okay, now we see that this is a chemical medical check is recommended. Then we can push this button. Okay, we can, now the patient should go to the laboratory to make the medical check. Okay, now we go to the laboratory and have this patient, and this is the items that she should be checked. The results are like this. This is positive, this is positive, and this is negative. And we can save. Now, the information has go back to the doctor. We can get the result. We can see the positive. Okay, I'm sorry. It seems there's something missing. Okay. Now we have got this information, further information here. Then we can diagnose again. Now we see that the disease has been almost determined. That is LSE with confidence about 80%. People may ask how you can get this diagnosis. Can you explain why you have this diagnosis? Then we can push this button and we can see why. The system tells us that the disease SLE is here. It is influenced by the sex, by the age, and also it has symptoms, the physical signs, and the chemical checks that we have done. And this one indicates that it is this disease, because this is a good medical check result. Okay, once we have, we can also ask why it is not the other disease. Then we can also have a look about why. We see that there are 4 isolated abnormal signals, evidences that cannot be explained by this disease. And the green one, green color indicates that it is expected to be positive, but now it is a negative. So it is a kind of negative evidence for this disease. Of course, we can have a look about why it is not this disease, because there's more isolated abnormal evidences that we cannot explain by this disease. Okay. So far, it seems that we have got the correct answer about the disease of this patient. Then we can write a record. Now we push this button. Now we get the record automatically. I don't want to explain the Chinese word, but it is a record about why, how a disease it is. Now we can, that is the disease. We can push this button, click this button to show you that we can choose the SLE disease. If you agree with this, you push this button, which means yes. If not, you can push this button. If you deny this diagnosis, the back end will have some person to check why you don't agree with the diagnosis. Okay. Here, we choose this disease as a diagnosis. We can also have a look about how to cure this disease. Now, these are the descriptions about how to cure this SLE diseases, etc., and about how to pay attention to it. And also, we can push this button to choose some medicines to take to cure this disease. I'm sorry, it is, okay. There's they recommended a set of medicines. This one, the set 1, set 2, set 3, and etc. For example, if we choose set 1 of the medicine, we can push this button, and then we can add them into the record. Now, these are listed here, and we can check. We can check if these medicines are okay. Is there any conflict, overlap, etc.? Then we push this button. Those have the same components are listed here, or some conflict will be listed here and explain what is conflict, etc. We can judge the treatment. Okay. Finally, we can, we have to move. We can save this record. So far, we have finished the diagnosis. We're limited, because of the limited time, I cannot show you how this system can do this. Now we go back to the slide, okay? So far, we have completed 43 DUCG knowledge bases for 43 chief complaints. Our diagnosis is based on the chief complaints because the patient does not know what department she or he should go. So what the patient knows is only about his chief complaint. So our knowledge basis is organized based on the chief complaints. Now we have completed the 43 chief complaints, and the diagnostic precisions verified by the third parties are 95% in average, and 80% for every disease, including those non-common diseases. And those knowledge bases cover more than 1,400 diseases and more than 10,000 ICD-10 disease codes. These are the, these are the name of the chief complaints. You can see that it covers almost all chief complaints. Finally, we have applied this system to the real world. We have applied it to more than 100,000 patients in 2 places. One is Jiuzhou City in Shandong Province, and another is in Zhongxian County in Chongqing City in China. And each place has about 1 million population. And this agreement is less than 0.5%. So the result is good. In early 2020, about 800 COVID-19 suspected patients in Jiaodou City were diagnosed. None of them had COVID-19, but the problem is that if he or she does not have COVID-19, what disease he or she has. So our system can give you the answer. So that is the key point that can avoid the patients to go to the big hospitals to be infected because of the gathering in the big hospitals. And the effect to increase the ability of the primary doctors are very effective, very obvious. These are three typical examples. The data are here, and the conclusion is that the ability of diagnosing a disease for less experienced primary clinicians are increased significantly by means of the tool DOCG. So my point of view is that we may not have to have the users, the primary clinicians, to do a lot of, to learn a lot of lessons. We can provide wisdom about technical tool so that they, with the tool, they can do better, and it seems like an expert to diagnose the disease. In this way, we can increase the skills of the primary clinicians a lot. So that's my presentation. Thank you.
Thank you, Dr. Pin. Excellent way of using technology, and particularly artificial intelligence related technology to forecast, diagnose, and prescribe the treatment protocols. And as you demonstrated, there seemed to be very, very high level of confidence of this tool, and it empowers the less competent clinicians to actually use this tool and diagnose in more effective manner. In the context of COVID, you talked about it avoids the overcrowding in big hospitals, and it's very, very useful tool. And if you look at this in the context of a skill development, and probably more and more, one message takeaway from what you presented is that there are a large number of technology tools that can be deployed in COVID prevention, management, and treatment, and they can be adopted, and particularly in countries like China and India, where we have a large number of people, and this can be very effectively used, which means this adoption at a scale would also need training of the not only the clinicians, even the people who are going to use, even the patients as well to a certain extent. So this is an important element when it comes to skilling in the context of COVID healthcare, is how do we actually train the people on use of technology applications, because that itself, technology is becoming a reality, particularly the kind of tools you talked about. Thank you so much, Dr. Finn. Can we now have Dr. Yang, the Expert Health and Social Care Project, World Skills Competition, China. Over to you, ma'am.
Hello, everyone. I'm very happy to be here to discuss with you. I'm very happy to learn a lot from previous speakers, the skills from doctors, the skill for different kind of situation. It's really good learning process. I'm here, would like to share something, our skill competition in China in caregiver level. So can you see my presentation now?
Yes, please.
Okay, great. So I will show it. Okay. I'm a nurse for more than 20 years, and now I'm doing some skill competition to train our caregivers and to improve their skills. In China, the skill competitions are very popular and important. It inspires our young people to develop passion, to award their expert award their excellent performance, to develop skill standards by communicate with each other. We also try to use the skill competition to influence the public, the industry, the government to pay attention to our occupation. So it's very important in China. Based on the skill competition level in our in China, we mainly have the skill competition for nurses. It's focused on the registered nurses or nursing students. They do some like the IVs, the life support skills, the carrying of tubes, catheters, or some intensive care skills. We also have this kind of skill competition focused on the elderly, the elderly caregivers usually didn't require very higher education level, don't need to have very higher requirement, but they provide care directly for our elderly people. They give them support on the daily life care and some mobility exercises, exercise to help them to recover, and some basic medical support like give oral medications, measure their vital signs. So these kind of caregivers do a lot to support our healthcare. And these years, from actually 2018, we try to build up another new occupation in China. It's named health and social care worker, or health worker, like this kind of names. We learned this from the world skill competition. We would like to learn these care workers to work in more settings, not only in the hospitals or organizations, but also in our community and at home. They not only focus on the hands-on skills, they also do patient-centered or client-centered care. They try to integrate all the daily life care, the mental support, or any rehab support together, try to make our people have a holistic support. So this is what we call it health and social care occupation. We learn this skill, learn this occupation from the world skill competition. Actually, it's the first time we attend this project, and we learn a lot from that. At that competition, actually, we already met your India competitors, Brazil competitors, and Russia competitors. We communicate with each other, and we compare with our practice and how to improve us. It gives us very good support. And we try to learn from the occupational standards. We found that comparing with our Chinese traditional skill criteria, we should not only focus on the hands-on part, we also added like the communication, interpersonal skills, the assessment, the evaluation, the problem solving, the coordinate, like this kind of criteria to help us to judge our caregiver is good or not, to judge our competitor do good performance or not. So in 2020, we have our national level health and social care competition. We designed 4 settings, like this one's hospital, the community, the daycare center, the residential, like the nursing home for people stay there a long time, and also at home. We use standard patients or standard clients. Actually, it's an actor or actress to pretend to be patient's clients. Then we can simulate the real practice situation. Then we can improve our skills to maybe we need use in the future in the real situation. since the epidemic outbreak bring big challenges to our training as well as to our competition, we try do our best to persist on our training and try to have some strategies to still keep our competition. So we use these several strategies. The first, we use our online training platform to have class, to discuss, to do everything, to communicate. We also try to deliver some small supplies, facilities to our competitors' home. Then they can practice at home. They don't need to go back to school or visit the hospital, which is not easy during the pandemic. So they can practice at home and improve, keep improving. And we also show our video through the camera to practice. Then the teacher can instruct our competitor, or we also can use the camera to demonstrate what's the good practice. So this is really help us to keep practice, keep doing, keep improving. Then when, since you all know in China, the pandemic was controlled very well last year. At the end of last year, it's almost no cases locally. So we are permitted to gather together to do our competition. It's true, it's safe, but we still do our best to control the risks. So all the participants, we will do our nuclear exit tests to make sure our safe. And we also monitor our temperature and self-monitor our temperature and symptoms and report daily. And we also use the personal protection and clean our disinfection, our environment to make sure everything is good. So this make our competition very successful. No any cases happened during that gathering, that big events. We also design the skills specific for the infection control to fight, to help us to fighting the pandemic. So we do some skills like the disposal of the medical waste correctly, to properly use our PPE, like the isolative gown. It's not easy to take on and put off, you know, and hand washing, and like how to clean our environment when patients leave, or how to deal with our garbages. All these skills demonstrate the standard way and help our competitors, our young people to improve. We also teach our actors, our standard clients, our patient to protect themselves through the education. So this is what we do in our skill competition. Through this kind of competition, we really developed our practice. We make public aware of the personal protection. We also teach them how to do that correctly. And we hope in the future, our competition will be more like a real situation. We try to improve our simulation part. We hope through our competition, our young people can learn the skill which they need to use in their practice, which they will use in their future career. Then they will be ready for their work and do good performance. Thank you. This is my experience.
Thank you so much. Thank you so much, Dr. Ann. It's so brilliant that during the pandemic, you actually used skills competition as a tool, as a method to inspire, influence, and to build capacity of the young people. It's a brilliant way of actually keeping the interest of the community, not just young learners, on the COVID management related. And it's in fact, the way you designed is also extremely good. It's not only just technical and non-technical and client management. A lot of those softer aspects have gone into designing these. So This is very, very useful. My compliments on behalf of all the participants here, or compliments to you for actually thinking through that a competition like this could be thought about, designed, and executed during the pandemic. And brilliant way of doing it. Thank you very much.
Thank you.
And any questions to Dr. Ann from the participants, please type out in the chat box and she will reply to those.
Yes.
Our last speaker from South Africa, Dr. Mabuya is here, the CEO of 360 Health. And can we have Dr. Mabuya, if you could kindly share the experience of South Africa in terms of skill building during the COVID pandemic? Dr. Mabuya, we can see your slides, but we can't hear you.
Dr. Mabuya, kindly unmute yourself.
Yes, I'm there. Sorry. Yeah.
Yeah.
Sorry. There we go. Thank you. Thank you so much. Sorry for that. Okay, can you see the presentation?
Yes, please.
Thank you. Yes. I'm just going to share some of the practical things. I'm more from the private sector. As you know, South Africa has got the private sector and the public sector. So I'm from 360 Health, as it's already been mentioned. I'm going to start with my presentation, and thank you so much for the invitation. Sorry. Just to maybe start off by saying, what is the business case for investing in skills development and improving the healthcare force? A key driver is really to drive an inclusive economic growth and investment contributing to decent work, job creation, particularly for women, youth, and rural folks and other underserved area is a key driver why we need to invest in skills. The heartbeat of an efficient and a well-managed healthcare system is by ensuring an optimum skills mix, intergenerational workforce, inclusive of the millennials, Gen Z generation, multicultural organizational expectations. Now, there's also a new driver, which is 4IR and digital transformation that drives our talent transformation in the healthcare sector, as we are forced to decentralize some of our training platforms. We can also see a global trend in that the 6 big tech companies seem to be investing most of their projects in healthcare. And because of the power that they have and the incentives to transform the healthcare, they are driving digitization in this particular market. So that's just some of the business case for looking at this. Now, what is the best practice in healthcare in the BRICS nations? Well, we do have a very strong regulatory and robust healthcare policies as a trading bloc, solid foundations since the dawn of the new democracy. In South Africa, also specifically, that has become even more stronger. We have an excellent workforce in terms of education, training institutions, higher national healthcare worker density than most African countries. So we seem to be structured on the actual, pipeline. How do we develop our own healthcare workers? Regulation is very strong also in the private sector. Even if we are working in the private sector, we are equally regulated like the people in the public sector. Our public sector health accounts for 80% of our population in terms of our healthcare needs. So the insurance, people who are insured are mostly in the private sector, which accounts for about 20%. And most of our people in the country get their healthcare needs, get addressed in the public healthcare system. The unprecedented pandemic of COVID-19 has disrupted and changed all aspects of our healthcare system. It has even exposed some of our past weaknesses. As you know, there was an issue of dealing with the past inequities and the legacies that we had. This particular pandemic has exposed weaknesses in our current healthcare system. Healthcare workers remain the vanguard of defense of humanity against the pandemic. And there is a 2030 human resource strategy that was critical, that was developed by our Department of Health. And as such, it's trying to achieve the mandate for universal coverage and the implementation of the national health insurance system, which is targeted around 2026. There is also a big challenge that the country faces, migration of skills or skills flight. There are not much incentives to keep people in the space, and I think the pandemic has not necessarily made things better for the healthcare workers in the country. Some people are basically leaving the profession, getting into other non-healthcare related non-healthcare related professions. Others migrate to other nations. So we are not necessarily sitting in the best space. And we've also lost a lot of healthcare workers to the pandemic. So that did not necessarily help our situation. In terms of the public healthcare sector, there is a document that has been developed, the 2030 Human Resource Strategy that has been developed to improve the performance of healthcare workers, improve the well-being of healthcare workers, very important. And also the strategy of the Department of Health also supports diversity, equity, and inclusion, which is really what is desirable going forward into the future. Now, just to talk about some of the key things in terms of diversity, equity, and inclusion in the culture of transformation, we do need to understand how employees are experiencing the culture and the impact of policies and programs. You need to hear more from your employees directly. So the issue of workforce data is very integral in helping us shape our policies and how we must respond post-pandemic in terms of this. There is a great use of telehealth services, mostly in the private healthcare sector, but also to a limited extent in the public healthcare sector. So the workforce data also helps you to map out exactly which specialists are in which province, and in that way you can then map in terms of saying patients can get the best outcome in that if there is no specific specialist. Let's take an example of a psychiatrist. Through the telehealth system, you can then link them up with a psychiatrist from another town, and I think that is helping in making sure that every part of the country gets access to the right level of care. There is also an element of the employee voice. The employee voice is a very important part. We've got very solid policies and laws in the country that govern how an employee's rights must be protected. And with that, what we've learned from the pandemic specifically is that employees need to be safe. They need to feel safe where they are. Critically, they also need to have support in terms of their mindset. So there's a need to create psychological support in terms of employee assistance programs. Employees also need to feel appreciated. I think the healthcare workforce was one sector where people, they didn't have the choice to work from home, like when you compare them to other professions. Many people could work from home except for the healthcare worker. And I think that sort of talks to how can we transition from what we did pre-COVID to the post-COVID days. There are certain parts of our work which can be done by a care assistant, not necessarily only by a nurse and a doctor. And those aspects of care assistance could probably be done remotely, but they still need to touch base with the patient. A person called a phlebotomist is a person who can take blood from a patient if you needed to test them. But after testing them, so a non-healthcare worker can be trained to do the test, sort of like a lay person. But after you've got the results, the reality of the matter is you need to connect with the patient. You need to bring the soft skills in it. And I think what the pandemic has exposed us to is that we seem to be very good on the technical aspects of handling things, but we are sort of we are thin on soft skills. Because that's really where empathy comes in, where connecting with the patient becomes important. And I think going forward, these are the things that any healthcare worker will need, in that we then need to have that cognitive ability to connect deeply with the patient and make them feel comfortable in the work that they do. We do not have a shortage of policies, processes, and programs. But what is important post-COVID is to review these processes and see if they are really closing the skills gap that we are trying to achieve post-COVID days. Just in terms of what is going to be important, I took the slide from the health catalyst, but I think it's talking to the soft skills, that the top 8 skills that every healthcare worker needs to have, especially if you are a leader in the workplace. Firstly, it's communication. We need to clearly articulate concepts and make sure that anyone in the work process can understand what we are saying. So issue of language, we have about 11 local languages in the country. So effective communication is becoming important. We can't communicate everything in one language. We have indigenous languages that must come into it, and especially with the telehealth opportunity that has presented post-COVID, is that instead of everybody rushing to the hospital, essentially people can call their doctor in the community, talk to them, who can do a triage, and then a certain percentage of patients need to go to the hospital or even need to call an ambulance. So I think that is becoming critical. It's a key one that has emerged post-COVID, that in terms of our training, we need to emphasize on the soft skills. Then also issues of building trust, articulate and communicate the vision and make sure that the outcomes are better. Now, trust building starts with a community center. In every community center, there is a local primary healthcare doctor that is serving that community, be it in an urban area, be it in a rural area. And I think even now with the vaccination strategy, if we can decentralize, instead of only vaccinating people only in the big centers, we can allow your family doctor, your GP, to take the lead and run, because the community that he serves or she serves trusts that person more than any other. So for me, those are the lessons that we need to learn post-pandemic in terms of what can we do to close some of this gap. Then the issue of coaching. Now, coaching is very important in healthcare because we are all having different experiences. There are new entrants, there's middle income career people, there's senior people. So meaning that the senior people need to be there to support the junior people. And I think this particular pandemic has shown us the gaps in terms of we don't necessarily connect very easily, because coaching is not an inherent attribute that comes with being a doctor. Most of the people are very good at diagnosing, treating, referring, and doing diagnostic tests because that's how they've been trained. But there's a gap in terms of coaching junior staff and making sure that they understand issues around being empathic, making sure that you are on time, and essentially you support patients. They don't necessarily have to be at the doorstep, but you can support patients even through a telehealth situation or even through a video process. Then the other issue that is becoming critical that we are definitely need to implement in our training of healthcare is understanding our management processes. Currently, there are different processes that we have, and we have that we are currently implementing, and basically what is really an issue, our processes are too manual. There is a very big need to move into a more automated environment, digitized environment, and any manual repetitive task can be eliminated. They can be eliminated by purely moving your support staff, your care assistants to a digital environment. And I think that will save time and also save patients' lives. Then another critical thing for our leaders in terms of a healthcare sector in skilling them is understanding the people that you are leading as a healthcare personnel. So it's important that you can't lead people if you don't know them. So that becomes important in terms of how far do they live from where they work? Because remote working will not necessarily work well in all situations. We do have wearables that we have where we encourage patients to monitor their own healthcare, and that can be fed onto a centralized hub, and essentially the doctor can monitor a patient remotely. But it's not feasible for every part of the country. So meaning that we then need to relook at how can we then use technology to help us make better decisions and also make sure that patients take 100% ownership of their decisions. Simple things like if you have a cough, not every cough needs an X-ray or a biopsy or a sputum test. People must be, especially our patients in the communities where we serve, we need to empower them in a way that they can take ownership of some of the decisions and really take care of self-care principles, and then they can call if they need to call before really rushing to our healthcare system. Because what this pandemic has shown us is that we do put pressure on the healthcare system by everybody just going straight from their home, maybe even to a clinic, without necessarily taking ownership of some of the small things which can be managed at home. And I think the future is talking to managing most of our healthcare issues at home if we can. So which means as leaders, we then need to improve our current training programs in such a way that it then takes a paradigm shift to then focus on those critical skills which are becoming important in improving the healthcare of the patients. Then the other issue is just really constructive accountability and managing conflict in the workplace. Those kind of things are important because during the pandemic, essentially you would then maybe find healthcare workers, even their support staff, sometimes really not taking full accountability of certain decisions. The issue of providing PPE, whoever is buying PPE for a healthcare unit needs to know the people that work within that unit to order the right size of PPE so that we don't then end up with ladies that are pregnant wearing PPE that is not designed for them. So those kind of things are becoming, and when people then criticize to say, but this is not the right PPE, then it means then we must hold the people that buy the PPE more accountable in that they then need to take a step backward, and when they do their demand planning for the unit, they need then to provide the right PPE for the right people so that nobody is feeling like they were just dumped with things which is not necessarily suitable for them. Then the other issue is really to make sure that we are resilient and we address resistance where it's possible, and we remain persistent and resolute in our work. Healthcare workers came out very in flying colors when it comes to some of these things, in that they never dumped their patient, whether they're working in a community healthcare center, a hospital, private sector, they were there. I mean, there was even a call to call people out of retirement to come and support the healthcare system. And I think that is because people saw a bigger picture in terms of ultimately what needed to be achieved in the healthcare sector. So people really showed their resilience, their tenacity, and the love for the profession. And I think we can really tap on those kind of attributes that emerged when we had the pandemic, specifically in the country, to improve our training. So for me, if I were to summarize everything I've said, 2 issues are needed to improve healthcare education and reskilling. We need to empower our healthcare workers to know their technical skills very well, which is what currently the training is mostly focused on. But there is a very big gap in terms of soft skills. And I think that's where we need to improve more. Soft skills can also be learned through e-learning platforms. It doesn't necessarily have to be through a platform, but I think what is also important is that our regulatory environment needs to move with the change in times, in that some of the things can be automated, and also some of the decisions that traditionally took like a week to make, they can also be made within an hour, and we can improve our work as we progress further. I think just in terms of what is being shared generally, what is the future looking like? We do need to look at this particular slide is taken from the McKinsey report also, which is talking to some of the things that I've already touched on. So I'm not going to go through all the slides, but it's basically touching on some of the critical skills that we need to help us become better healthcare workers. In terms of our critical thinking, we need to be structured. We need to be more aware of structured thinking, understanding the situation and the biases that could be there. Issues of self-leadership I've already touched on the previous slide, and the issue of improving on interpersonal skills and addressing some of the things well. And on the side of technology, there's a lot. Telemedicine became a very big field during the pandemic, and I think our growth is really in that space because we are sitting in a situation where, as a country, we have good penetration when it comes to our telecommunications sector. We are connected as a nation. Every part of the country, I would say 80% of the country has got access to electricity, to a telecommunications system. So that in itself is presenting a completely new opportunity in the digital space for us. And I think as the healthcare community, we need to take a cognizance of what is emerging in front of us. Obviously, there will be challenges. Things like when we become more interconnected as people, there's issues around cybersecurity, data privacy, but all that, it's something that doesn't stop us from taking advantage of the digital world, because the reality of the matter is we are going to have a skills shortage in the future. We've lost a lot of specialists, we've lost a lot of nurses and other healthcare workers in general. So in reality, we can train and train, and it looks like we are going to live with more pandemics going into the future. So we then need to revisit a different model of reskilling our people. I will stop there, and thank you so much for this opportunity to present. Thank you.
Thank you very much, Dr. Mabuya. And you rightly pointed out the skill development, particularly to handle the pandemics and to cope with the kind of crisis that such pandemics create. Just being technically sound is not adequate. And you need to have a lot more. You talked about empathy, you talked about the policy understanding. To last slide, you talked about those foundational skills, very, very important. Otherwise, this crisis of COVID-induced pandemic is not an ordinary crisis. It affects families, it affects workplace, everybody. So very well put across, Dr. Mabuya, of the need to have a very, very holistic view. Before I request Sumit to sort of summarize and sort of propose word of thanks, and we have Mr. Dilip Shanai here, the Secretary General of FICCI, and who actually leads the entire FICCI's work on the BRICS Business Council. Dilip, would you like to share any inputs?
No, I just want to echo your thoughts that you had actually shared with everybody for the excellent presentations, right from the Brazil presentation when I joined in, to the use of technology in the China presentation, using skills here. And I think this whole South African presentation of how they innovatively looked at using the whole COVID thing to look at the healthcare system and the skills and the competencies of the entire workforce. So I want to thank each one of them for being here, and thank all the participants. I've been actually following it on chat. A lot of interesting comments have come on chat, and thank you, Chairman, for actually leading this effort. So, thank you for that.
Thank you very much, Dilip. May I now request Sumit? Before I request Sumit, a brilliant job done by the FICCI Secretariat here. I'd like to particularly call out Ramita, Amit, and Sumit under the leadership of Sumit. The team has been working very, very hard to get the skills working group as tight as possible in terms of coordinating the respective countries. Going forward, we look forward to greater participation and support from our other member countries. So far, it has been excellent. Over the next few months, let's try to build on what we have done so far in order to achieve the objectives, that 4 or 5 objectives that we have kept ourselves. Now, may I request Sumit to sum up and propose vote of thanks.
Thank you, Chair. Thank you so much. In fact, I would like to take this opportunity to thank each and every speaker who has joined and shared their experience. It indeed was a great learning experience for me, and I'm sure all our participants would have definitely benefited out of it. The kind of initiatives which each of our member nations have taken, the commendable initiatives, and there's so much to learn from that. Going forward, we would be capturing all these practices, the best practices, if I may say so, in form of a compendium. So whatever has been discussed today, that definitely is going to be with us. But in addition, I request all the members who are present there to share some additional information if they would like to. We'll create a compilation of all such practices across BRICS nation and put it on the knowledge portal, which currently we are managing, so that it becomes a knowledge repository for anybody who would like to go through it and be benefited out of it. So that is one part. And as I think Chairman also pointed out, going forward, we would be having many other such roundtables and policy discussions, and where I encourage all of those who are today who are joined to of course join us, and also percolate this kind of information among your network, so that all of your colleagues also sort of get benefit out of this. With these words, I once again thank all the speakers, all our colleagues from the BRICS nations and the participants from all the BRICS nation. And thank you so much, Chair, for your leadership and guidance to make this happen. Thank you so very much and have a great day.
Thank you. Thank you very much, everyone.